All right, so let's finish this last lecture up. We are going to cover ear disorders now. Our first ear disorder is external otitis or swimmer's ear. This is an infection or inflammation of the lining of the external canal. Signs and symptoms include pain that increases when the auricle or pinna is pulled, itching, hearing loss, fever, or drainage. The medical treatment includes topical antibacterials or antifungals, some mild analgesics, corticosteroid drops, and oral antibiotics. Next, we have otitis media. This is a middle ear infection. It usually develops following a cold. With otitis media, edema occurs and blocks the eustachian tubes. Fluid then accumulates in the middle ear. This causes painful pressure on the tympanic membrane. And if it is severe enough, the membrane could rupture. That's the eardrum, and that causes scarring and could lead to hearing loss. Patients often have a fever, a headache, and complain of otalgia. Otalgia is ear pain. They may have drainage, feeling of fullness, and a hearing loss with tinnitus. This is more common in children than adults, but we still see it in adults. Medical treatment, some medications you can use with otitis media to treat otitis media include antihistamines, decongestants, oral antibiotics, and topical ear drops. Treatment, a myringotomy. This is for a surgical treatment in which they put an incision into the eardrum, and it treats patients who have repeated episodes of otitis media, or if they're having issues with that extra fluid not reabsorbing into the body, the patient will need a myringotomy. And just that to explain that incision in their eardrum relieves that, helps relieve the edema and the pressure. Our next disorder is labyrinthitis. This is an inflammation of the labyrinth. The labyrinthitis usually follows an acute upper respiratory infection, such as acute otitis media or pneumonia or influenza. And the effects of labyrinthitis actually destroy the labyrinth and the cochlea and can cause permanent deafness. Signs and symptoms include vertigo, nausea, vomiting, tinnitus, as well as headache, some anorexia, nystagmus. Sensorineural hearing loss on the affected side can also occur as this progresses. Medical treatment is meclizine. Meclizine is typically the antihistamine of choice, especially in these inner ear issues that cause dizziness. It's very effective with treating dizziness. Antiemetics and supportive care until it resolves, and antibiotics if the patient has a fever. Our nursing responsibilities including implementing safety measures. Again, we're dealing with the inner ear, we're dealing with patients experiencing vertigo, and it puts them at risk for falling and getting injured. So be sure you're implementing your safety precautions and giving the patient's medications as ordered and making sure the patient stays hydrated. We want to we last thing we want is for the patient to become dehydrated. Nausea and vomiting can increase as a result of that. So we want to make sure the patient is hydrated. Our next disorder is Meniere's disease. This is a disorder of the labyrinth. They do not know what causes it. Symptoms are related to an accumulation of fluid in the inner ear. The degree of Meniere's disease is different for different patients. Some manage a normal lifestyle with Meniere's disease. They have mild symptoms and are able to implement treatment and just live normal. Whereas other patients with Meniere's disease have such severe symptoms, they can't work or drive and end up on disability. Signs and symptoms: dizziness with severe nausea and vomiting, tinnitus, unilateral sensorineural hearing loss, and poor balance. The poor balance leads to ataxia, um, which is loss of control, full control of your body movements. These patients have problems with coordination and an abnormal gait. Treatment: there's no cure for Meniere's disease, so we're going to treat the symptoms. So medications are important, things such as atropine, diazepam, meclizine, antihistamines, antiemetics, anticholinergics, anticholinergics, vasodilators, and diuretics. The patient may be placed on fluid restrictions if fluid accumulation is severe in the inner ear. They may also require a low sodium diet for the same purpose, for the same reason, and a quiet environment for rest. They will be on bed rest. They may, the doctor may order vestibular rehabilitation. That actually helps the patient. It's a therapy to help the patient balance and decrease the dizziness problems. Surgical treatment. If the patient has severe frequent attacks, they may do a surgical procedure to relieve that problem for the patient. But we're not going to get into that. But we are going to talk about patient education. For nursing, this is vital. We are educators, and we need to educate our patients about their disease. So be able to implement patient education for Meniere's disease. These patients should avoid using alcohol or tobacco. They need to implement antiemetic medications, PRN, to help reduce the nausea and vomiting. They need to learn to move their head slowly and their eyes as well. This will decrease the vertigo. They should conserve their energy during the day, decrease sodium intake, and take their diuretic medications as ordered by the physician. Our next disorder is autosclerosis. This is a hereditary condition in which there's an abnormal growth that causes the foot plate of the stapes to become fixed. The fixed stapes cannot vibrate, so the sound waves are not transmitted further into the inner ear, and so these patients suffer conductive hearing loss. It's most common in young white women and usually presents during pregnancy. It's more pronounced. Signs and symptoms: a slowly progressive hearing loss. In the absence of infection and in the early stages, patients may report tinnitus. The Rhine test reveals bone conduction is greater than air conduction. The medical treatment is a surgery, and that is a stapedectomy. A stapedectomy removes the stapes bone and replaces it with a prosthetic. Care of the patient having ear surgery, the stapedectomy. Post-op, we want to address the patient's pain. Make sure we have safety implementations. implement safety precautions implemented, prevent infection, and avoid pressure in the ear. It's especially important that the patient doesn't do any activities that increase pressure in the ear. And nausea and vomiting and vertigo are common in these patients. So it's vital that we implement safety precautions. And with a stapedectomy, the doctor will place packing in the ear, and that should not be disturbed. Just to go over safety precautions, you want to make sure you raise the side rails. You want to look in on the patient frequently. Assist the patient to the bathroom due to the balance being affected. Again, dizziness, vertigo, and ataxia are all symptoms, and so we want to implement safety measures to prevent harm to the patient. On page 621, you have home care considerations for the patient after ear surgery. And so you want to teach the patient to avoid any of the things listed, which would increase the pressure in the ear. So look over that. It is sneezing, coughing, nose blowing, drinking through a straw, heavy lifting. They should avoid heavy lifting. They should keep the ear dry for 4 to 6 weeks. Once the initial dressing is removed, we can teach the patient to place a cotton ball in the ear to protect it. They should avoid sick people. They should not fly until it is approved by their surgeon. And I think that's all that I want to cover. There's a few more things on your list. Just be sure to look over that and be able to teach a patient appropriate measures after a stapedectomy, after ear surgery. And this slide is talking about implementing the same concepts that we just talked about, that it is in the teaching on page 621. And that is all of your junior term lecture. Congratulations, guys. You do not have to put up with any more of my lectures. And I do pray that your senior term is a normal term and you don't have to deal with any of this craziness that's going on.